Hello. So last time we talked about introduction to the pelvis and its perineum. So today we are going to talk about the arterial supply of the pelvis. Okay, so we start with the heart. The heart will pump oxygenated blood via arteries, the major artery being the aorta. So from the arched aorta, we go to the thoracic aorta. Then after passing the diaphragm, it will change name into the abdominal aorta. Then at the level of L4, this abdominal aorta will bifurcate, okay, into common iliac arteries, because these are the iliac fossa, so they are called common iliac arteries. Then at the level of the pelvic brim, it will further divide into internal iliac artery, which becomes the major artery of the true pelvis, and an external iliac artery, which is medial to the psoas and the iliacus. It's cushioned by the psoas and the iliacus. Then after passing the lower border of the inguinal ligament, it will change name into the femoral artery. Okay. Then again we have the inferior vena cava. Okay. Inferior vena cava at the level of L5, it will divide into two. Okay. Divide into common iliac veins. Then again, now at the sacroiliac joint, the common iliac veins, they divide into two, external and internal. External, it goes and becomes the femoral vein. Then the internal, it descends into the perineum and it will drain structures in the pelvis. It descends into the pelvis and it will drain structures in the pelvis. Okay. Again, another diagram. The common iliac artery divides into two at the level of the pelvic brim. External, internal. Internal goes into the true pelvis and becomes the major artery of the true pelvis. The internal iliac artery has an anterior and a posterior branch. These branches, they have parietal divisions and visceral divisions. The parietal division will supply muscles and related structures. The visceral divisions will supply the pelvic organs. Okay, so to start off with the posterior division. So the posterior division, we use the mnemonic code PUS. P standing for posterior division of the internal iliac artery, I standing for iliolumbar artery, L standing for lateral sacral arteries, and S standing for superior gluteal artery. Again, the first one, iliolumbar artery, ascends up out of the true pelvis into the false pelvis and supplies related structures in the false pelvis. Okay. Then the the lateral sacral arteries, they'll enter into the sacral foramina and to supply structures related there. Okay, it will supply related structures near the sacrum and the sacral foramina. Done. Then the superior gluteal artery, okay, it will exit the true pelvis via the greater sciatic foramen, and it goes to the gluteal region and supplies gluteal muscles or buttock muscles, the muscles which you sit on. Those are the gluteal muscles. Done. Okay, now we go to the anterior division. The posterior division only gave us parietal branches. The anterior division will give us parietal and visceral branches. Okay, so the visceral branches, we have the umbilical artery. So the umbilical artery, it gets obliterated and to later become the medial umbilical ligament. Okay, but before it becomes the medial umbilical ligament, it gives off a branch called the superior vesical artery. So whenever you hear the word superior vesical artery, I want you to think of the what? Of the blood. When you hear the word vesicle, think of the blood. Then before that, I just wanted to show you the superior gluteal artery. Okay, so the superior gluteal artery, this one, can you see that it's getting into the greater sciatic foramen, coming from the what? From the internal iliac artery to supply this muscle. Okay, now this one, the superior vesical artery, will supply the superior surface of the what? The blood. Let me show you. Okay, the superior vesical artery, this one, which is a branch of the internal iliac at the anterior division, which supply the superior surface of the blood. Okay, good. Then another visceral branch, the inferior vesical artery, this one, anterior division, it will supply the posterior surface of the blood. Okay, this one, inferior vesical artery. In men, it will supply the posterior surface of the bladder. Not only the posterior surface of the bladder, it will also supply the seminal vesicles and the ductus deferens. In females, it's called the vaginal artery. It's called the what? The vaginal artery. Okay. Then another visceral branch in females is called the what? The uterine artery. The uterine artery. It forms a very important relation with the ureter. Ureter comes from the what? The kidney. It contains urine. So it crosses over, the uterine artery crosses over the what? The ureter. This is very important. Because let's say, for example, there is a cancer in the uterus, okay, and we are trying to remove the uterus and its associated arteries. We should bear in mind not to be careful when we are dealing with the uterine artery. The uterine artery will supply this one. You see, this is the uterine. It will supply the body of the uterus and the uterine tubes, okay, and even the cervix, some part of it. All right, it's the major supply of the what? Of the uterus. All right, so it's very important to take note of this what? Crossing off. Okay, good. Another visceral branch is the what? Is the midrectal artery. This one. The midrectal artery will supply the upper portions of the what? The rectum. The rectum will be somewhere here. Okay. So the upper portions of the rectum will be supplied by the medial rectal artery. Okay. Done. So those were the visceral branches. Okay. Now the parietal branches. The first one, we have what is called the obturator artery. The obturator artery supply the obturator internus muscle. You can see here it's covered by fascia here, by pelvic fascia. So the obturator internus muscle will be on the obturator membrane, but the obturator membrane is not complete. It leaves a tiny opening which you call the obturator canal, which forms like the exit passage for the obturator artery and obturator nerve. Okay, good. Another parietal branch, okay, is the inferior gluteal artery. Inferior gluteal artery. It will exit the true pelvis via the what? The greater sciatic foramen. This one. Okay. The inferior gluteal artery. Inferior gluteal artery. Okay. Here. It's exiting the greater sciatic foramen. Okay. And to supply muscles of the gluteal region. Supply muscles of the gluteal region. Okay, these are the muscles of the gluteal region. Good. Then another one is the internal pudendal arch. Internal pudendal arch. Okay, so it exits the true pelvis via the greater sciatic foramen. Then it enters the perineum. Okay, enters the perineum via the lesser sciatic foramen. So this one will supply structures in the what? In the perineum. This is the arch. Supply structures in the what? In the perineum. For now, let's just appreciate that it will supply structures in the what? In the perineum. It's like the major artery for the what? For the perineum. Okay? Because this artery will later enter into what is called the pudendal canal. Okay? And to supply structures in the perineum. Okay, good. So those are the arteries. Okay, talked about the uterine artery. Okay, so the uterine artery is enclosed in what is called the broad ligament. So the broad ligament is like the jacket which encloses the arteries and kind of weakly supports the what? The uterus. So these vessels are enclosed in the what? In the broad ligament. And we can see that the vaginal artery and the uterine artery have anastomosis. Okay, good. Right. So that was the internal pudendal artery. Okay. So there are also other arteries which supply this true pelvis, which are not branches from the internal pudendal artery. Some of them are the ovarian artery. The ovarian artery. The ovarian artery will enter into the true pelvis and to supply the what? The ovary. It also form anastomosis with the uterine artery. Okay. Supply the what? The ovary. Good. Another artery is the superior rectal artery, which is a continuation of the inferior mesenteric artery at the level of the pelvic brim. This artery not only supplies the upper part or supplies the rectum, it also supplies the upper part of the anal canal. Okay, good. All right. So yeah, that was like the arterial supply. Now we go to the venous drainage. So the veins, they will follow the what? The arteries. Okay, so the veins, they are going back to the heart. So the external iliac artery, okay, this one, you see. Then the internal iliac artery is formed from these tributaries. Okay, they unite to form the internal iliac artery. Then at the level of the sacroiliac joint, they will unite. They unite to form the common iliac artery. Okay, good. these are the ones which will drain the true pelvis. Good. Right. Okay, then another important no, it's okay. Okay, then the last artery which I did not talk about, which supplies the true pelvis, is the median sacral artery. This median sacral artery will also supply the sacrum and related structures in the what? In the true pelvis. Good. Right. Then here we're just showing us that the superior rectal artery is a continuation of the inferior mesenteric artery. Good. Then on venous drainage, you should appreciate the fact that we have portal systemic anastomosis in the true pelvis. Okay, this occur between the superior rectal vein, the inferior rectal vein, and the middle rectal vein. The superior rectal vein, okay, and in fact the middle rectal vein and the inferior rectal vein are branches of the internal iliac vein, and the superior rectal vein is a continuation of the what? Inferior mesenteric vein. So the inferior mesenteric vein, it goes and drains into the liver, and the middle rectal vein and inferior rectal vein, they eventually drain into the inferior vena cava by first draining into the internal iliac, which then combines with the external iliac to form the common iliac, and the common iliac and common iliac form the what? The inferior vena cava. So this is the systemic system, and this is the portal system. So that's why we say that there is portal systemic anastomosis. So if there is like liver damage here, it means that blood is no longer draining freely into the what? Into the liver. So blood will take another route to go into the what? Into the systemic system, or into the inferior vena cava. Okay. Then lymphatic drainage will just start to follow the what? The vessels. Okay. So they'll follow the external iliac vessels, they'll follow the internal iliac vessels, they'll follow the what? The common iliac vessels, like that. Okay, so that was it, guys.